The filler is injected underneath the skin in the penis, so it makes it thicker, which is the main effect. So you get a thicker penis. It also ends up being because it's thicker and it has a substance in it, it ends up being heavier, which means it indirectly gets longer. And once the filler gets a little bit solid, it kind of it almost has like an exoskeleton kind of thing or a scaffolding that will make the penis longer at all times because it can't shrink. As listeners know, the penis shrinks and expands all the time. Well, this is going to make it shrink less and stay in that expanded state more.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who's out there helping us humans to explore, expand, and explode.
Hey, welcome to The Exploding Human. My name is Bob Nickman. Today my guest is Dr. Joel Pash, and we're going to be talking about penis enlargement. Not a topic I ever thought I'd be doing on this show. However, that's what we're talking about today. Joel is an anesthesiologist who got into this field a number of years ago. We talk about what the procedure is, why people get it, and who are the type of people that get this kind of procedure, which actually spans a whole spectrum of people. I knew nothing about this topic, so anything you're going to learn on this episode, I'm learning with you. Let's get into it. This is Dr. Joel Pash. Good morning, Joel. Glad you're here. Nice to see you.
Nice to see you too. Thanks for having me.
Yeah, and we are going to be talking about penis enlargement, among other things. So my first question, and I always wonder about this, what is the most frequent reason and some of the other reasons people want to do that?
I would say the most frequent reason is people that want to have some more fun or something like that. It's not necessarily that they have a small penis or they're concerned about it, but it's common that someone, say their partner had breast enlargements or butt implants or something, or even just Botox or face filler. And nowadays, guys are getting more into these kind of cosmetic things also. And so besides for Botox and face filler, this is what we got. The other reasons are kind of lack of confidence about what they have. And in most cases, actually, guys might not be confident, but they're just fine. But still, maybe something happened, previously with a partner in the locker room or something like that kind of affected their confidence. So that's like a secondary reason. It's actually not common that people actually just have penises that are too small and that we're actually fixing something. It's usually just improving whatever they have.
Yeah, so it's a little bit of, I guess, vanity, I would call it that, and psychological in a sense that if my penis is bigger, I'll be more of, I guess, a man, or I'll be more desirable. Or this is the other thing that I might think, somebody who's not very successful in the department of dating and finding partners might think that that's a solution to a problem that isn't really the problem.
Yeah, I don't want to say that's common, but I definitely get those people. And as you said, that's not the problem usually. Yeah. People might think it's the problem, but usually it's something else, right? But having said that, even if it's not the problem, sometimes doing something that improves yourself might increase your confidence and maybe you'll solve some other issues that are the problem. And I don't know if that actually happens or not, but I do know that regardless of why the guys are there, they're almost always happy.
Well, I guess that's a good thing if they're happy about it. Now, here's another question. You ever have a woman come to you on the QT and go, I want my partner's penis to be bigger. Can you give me some tips on how to get him in here? You ever have that?
Certainly, we've had phone calls about that. Now, I don't answer the phone, but I do kind of see some of the transcripts if they exist, or some of like we have a lot of people contact us by text messages, for example, so I can see those. Yeah, sometimes rare, but every now and then we'll have a partner saying like, I want to get my boyfriend, husband in or whatever. I'm not sure if those people actually ever come to our office because just because I see a text conversation, it doesn't mean that becomes one of our patients. I have had very commonly, though, people bring their wives or girlfriends or boyfriends or whatever into the office. And in that case, it's more like the first option we talked about, which is that it's not like they're too small or whatever, but it's that they've decided as a couple that this will be a fun thing to do.
Well, this is so out of my wheelhouse. That's why I'm fascinated by it. It never even occurred to me to do something like that. And I'm not particularly large myself. I'm like an average person. I've had, nobody went, oh, it's too small or it's too big or it's whatever. I'm right there in the zone, I guess. So I haven't really thought about it. So let's get into how you got into this field. You go to medical school, you become an anesthesiologist. You, what else? Some type of a surgeon, obviously, because you're doing surgeries.
Well, actually, it's not a surgery, it's an injectable procedure.
Oh, okay.
So, yeah, and I don't know if the listeners know, but anesthesiologists actually are injection specialists in a certain way. Like we
Yeah,
do,
sure.
we do a lot of nerve blocks, which use needles or inserting different kinds of vascular lines, like central lines or arterial lines. So all these things use needles, and so I would say that's like what uniquely makes us qualified to do this procedure. Being an anesthesiologist, looking to get into other aspects of medicine, injectable procedures is one of the things that would be reasonable for us to do. I have a background in business as well. I have a business degree, and I was a management consultant before I went into medicine. I don't think that's why I ventured into this, but it certainly there's some people that are, business people, and there's some people that aren't. So from that perspective, I was able to start this business. And how I actually found penis enlargement was just completely random. I was just talking to a guy that did medical marketing one day, and he told me about it. I'd never heard of it before. It wasn't something I considered doing myself or anything like that. It was just I kind of heard about that, and I thought, that's interesting. I should look into it. Once looking into it, I realized it was a legitimate procedure that actually worked, and so it was worth looking into it further.
Sounds like it was an underserved market.
Still is, in the sense that guys don't know about it the same way that women know about things like breast implants or facial filler. But it is growing in the sense that there's more people doing it and more patients getting the procedure than there was 3 years ago.
Yeah, with women, those things you just talked about, they're things other people can see as they move around through the world. They're literally out there
Yeah.
in the world, and you can see their breasts, you can see the results of all the face work and all those types of things. But with a penis enlargement, pretty much you're not only maybe a few people are going to see that. So it's a very specific audience, I guess we could say.
Yeah, it's a valid point, right? Like that's maybe why breast enlargements are, well, it's most certainly why breast enlargements are more popular, right? Because when we get patients in there, like I said, they're almost uniformly happy, but they'll say something like, I wish I could refer people to you, right? But I'm not going to tell everyone that I got this done. Whereas if it was breast implants, everyone sees it. You come into the office the next day and your breasts are twice as big as they were the day before. Because of that, everyone knows about that being a thing.
Well, I've had women tell me that it's really made them confident when they've had the, breast enlargements, or I've always wanted this, and this is something, without any judgment either way, that, I think there are people that feel better about themselves when they get something like that. Then there's also sort of the downsides of procedures later on down the road. So tell me about what an injectable is. Where is it injected? Is there more than one place? What substance is going in there? What are the, just tell me walk me through the procedure a little bit. It's
Yeah. So we're injecting dermal fillers, which is literally the same products that women would get in their face, most commonly in the lips.
Mhm.
So fillers can be made up of different substances. The one that we use is a hyaluronic acid filler. So hyaluronic acid is what is found, it's found naturally in your body. It's the matrix that cells are in. So if you were to go in a microscope and look at your cells, they would all be, it's kind of like the scaffolding that holds the cells together. So that's hyaluronic acid. The thing that's nice about that is because it's natural to your body, it tends to have a low incidence of reactions like allergic reactions or immune type reactions. The filler is injected underneath the skin in the penis, so it makes it thicker, which is the main effect. So you get a thicker penis. It also ends up being, because it's thicker and it has a substance in it, it ends up being heavier, which means it indirectly gets longer. And once the filler gets a little bit solid, it kind of it almost has like an exoskeleton kind of thing or a scaffolding that will make the penis longer at all times because it can't shrink. As listeners know, the penis shrinks and expands all the time. Well, this is going to make it shrink less and stay in that expanded state more.
Oh, I didn't. Okay, now I'm learning a few things that I didn't know. I just had this odd idea of you opening a special clothing line that shows your work through a person's pants. So it's a big seller for you. So you're in business. So here we go, clothing line.
Actually, I really like that idea. So it's like you're talking about you're wearing pants, but the pants have an image of a penis on them.
No, I think they're just tight and in a way that shows the actual bulge.
Oh, I see what you mean.
Yeah.
Yeah, just tight pants, like they used to.
Yeah.
Like Robert Plant in Led Zeppelin in the 70s.
Yeah, when they're putting cucumbers in there and
yeah, exactly.
look huge, but this is authentic. Maybe even we'll get to the point because we're such an odd culture that'll be a see-through thing, so you can actually see the work that you've done.
Well, did you see it was like I think whatever it was the Grammys or the Oscars the other night? I saw. Now, I'm not into popular culture that much, but I saw this on Google News or something like that, and one of the actresses there had a dress on it's like called a nude dress.
Yeah.
So it's actually completely see-through mesh. So she's only like technically wearing something, but
yeah. So
when you look at it, she's actually wearing nothing. So I mean, I guess that exists, right? If guys wanted to.
It's there for women. It's not so much for men, but yeah, that's it's an odd thing, like I always found a little bit of mystery more exciting. It's like I want to imagine what's there. It's like a naked woman versus one in lingerie. Which one is actually more inviting? And I would say with a little mystery. I think that's kind of a nice thing, but commenting on our culture always gets me upset. So
right. Yeah, I think it's like probably morphed into a worse like situation over time.
Like how far can we go? Maybe we do a thing where we surgically open a person and we can see their internal organs when they go out.
Well, that's like the next step, right? Because you don't have to wear clothes, basically.
It's a funny discussion. So, is there when you say you're injecting, I'm going back to the procedure.
Yeah.
When you're injecting it into the skin, is it all around the penis or is it one area or, is it multiple injections? Is it nothing goes into any kind of veins or anything is what I think what you're saying.
You definitely you never want to inject anything like this into a vein because the vein's there to have blood flowing through it. So we don't want to block that. Basically, we're injecting the filler all around the penis, trying to cover the whole thing with kind of to make a thicker layer kind of. It's kind of like putting 100 coats of paint all around it,
Yeah.
and so it makes
Yeah.
it thicker.
Okay, like putting icing on a cake, multiple layers maybe.
Yeah.
So it's a lot of little tiny injections is what I'm picturing. A very thin needle. So that's what I'm picturing. I might be wrong.
No, it's because like needles can be a few inches long, right?
Yeah.
So let's just say the average penis is 4 inches and you have a 2 inch needle, you would only need two holes to
Oh.
cover the entire
Oh, so
length
it's a
of
very,
it.
yeah, it sounds like a very quick procedure then.
Yeah, it's about 45 minutes. It could be like 2 minutes. It's just that 45 minutes is what's necessary to, meticulously cover the whole thing evenly and make it look good. But, if you were just injecting filler not carefully, it would just take a minute. So it's a simple procedure technically, but it requires some finesse and artistry and
Yeah.
all that.
So is the person asleep or anesthetized in any other way, or is it, or are they just going, or just laying
It's
there?
like getting a haircut. You just come in and we numb the area. So
Topically?
just no, just it's like just like when you go to the dentist, they just numb
Oh,
the
okay.
specific
All
area
right.
you're looking in.
So like a Novocaine type thing. Okay.
Yeah, so it is a needle. Basically, the if the patients feel some numbing for 10 seconds or so, and because that is a needle that needs to do that, but after that, they don't feel anything at all. It actually numbs quite well.
And then what's the recovery time or the time what, as you explained how it sort of changes over a little bit of period of time. What's that? There's like is there a recovery and then a time that it gets bigger and more longer and firm and all that kind of stuff that you were talking about? What's that window?
The filler that we put in doesn't expand or shrink or anything like that. So what we tell people is we're putting in a material, and the amount of material we put in, that's how much bigger it gets. So in that sense, they see the results immediately before as they leave, it's bigger, and that's how big it's going to be.
Mm-hmm.
There's some swelling and bruising and stuff like that, as there would be with any injections or medical procedures oftentimes. And that lasts about a week, maybe 10 days or so. So to the extent there's any recovery, it's just that there's like some bruising or mild soreness. It's not the kind of thing where you need to take time off work or not go to the gym or any of those kind of things. I've literally had people come on their lunch break that work near the office.
Oh, okay. What about sensitivity? Does that change at all? Because you do have other things going on in there now.
We think that it doesn't change it. We're going underneath the skin, and most of the nerves are in the skin itself, and we're not cutting anything. So it's like if you have surgery and you get something cut, it actually cuts through nerves. But with a needle, it just kind of goes around the nerves.
And are there non-injectable ways of enlargement?
Yeah, there's surgery for starters. I don't recommend that. Some of them are fairly invasive and can have complications that would be unacceptable to me. If I came in with a normal penis, I would want to leave with one that worked just as well. And so some of those complications I've seen that's not what happens. So I don't really recommend surgeries, but that's certainly one way of doing it. And then you have all these things like a lot of people use pumps or stretching devices, or other people put all kinds of weird stuff in there that besides for medical injectables. None of those, like the stretchers and the pumps, don't really work. They work temporarily, but they don't tend to have long-term effects. And then there's pills too, right? And so pills are usually a scam. Some of them will have like Viagra type effects where you have a temporary increase, but it's not something that's long lasting.
Yeah, well, this seems like the simplest version of what you're talking about.
It's the simplest thing that works for sure.
Yeah, it's a whole world I don't know anything about. But like you were saying before we started,
I was saying to you, like, I don't even think about my penis. I don't like walk around thinking about it. And then you said, I don't either.
Yeah, I mean, to the extent that it's my livelihood to working on other people's penises, I don't think about it. So I guess that's factually incorrect to say that I don't think about penises. I
Yeah. No, your
think
own.
about it all the time, but
Yeah.
but in a different context, so to speak.
Do you get porn stars in there? They want to look bigger on screen. You had any of those people?
Oh yeah, I have a few. I have a bunch of guys of OnlyFans
Oh,
performers, so that's
yeah.
that's like the big new thing now, right? But I do have, I can think of two actual like traditional kind of porn stars that do. I don't know if people have DVDs anymore or something like that, but like
Yeah.
internet, like on like
Yeah.
actual paid people that are in
Yeah. They have a
multiple.
platform that they perform on and get paid to do. You should get a residual check every time that they perform. There's another business idea for you. No cost up front, but every video after this, you get 10%.
Yeah, well, one of the guys I've actually become friends with, and one of the porn guys, he's kind of my age, and he's been in my office a lot, and so we've kind of become friends over the last few years, and so he's been really helpful at actually helping me with testimonials and all kinds of things like that have actually helped the business.
So people get multiple procedures. They get like a booster shot.
Kind of like the filler, first of all, lasts about 2 years. The body breaks it down over time.
Okay. Okay.
So that's one thing. But the other thing is, especially if you're a porn star, but with a lot of guys, it's kind of like a tattoo addiction almost. You know how guys, they'll get a tattoo, but then they get another one and another one. So some of these guys that come in, they come in, they think they only want it to be a little bit bigger, and then they come back two or three times, and it's next thing you know, it's like a monster. Which is what they wanted. They didn't think they wanted that, right? But they kind of moved into that over time.
Wow. So how big can it get? How much bigger can it get without being maybe even harmful? I don't know if it can be harmful, but it seems like there would be some kind of a limit.
Well, the limit tends to be just what looks absurd. There's a lot of analogies to breast implants, like I brought up before. Like you'll see women in theory that can have, like triple Fs or some
Yeah,
absurdity. It
cartoonish.
just doesn't look real at
Yeah.
all. So we can put in a staggering amount of filler and make it huge, but the proportions then are off and it just doesn't look right. So realistically, it's kind of like if we're talking about circumference, the average person's circumference is 4 inches, flaccid, maybe 4.5 inches. And in order to keep it looking somewhat reasonable, we're probably talking about adding 2 inches of circumference. So that's quite a bit.
Yeah.
We're not talking about subtlety, but we're not tripling the size, right? Maybe we're increasing the circumference by 50%. And then length, it usually tops out at about an inch, no matter what. There's a limit in the length, and just in terms of the penile tissue that's already there. Like you can't make your urethra longer, and you can't make your nerves longer, and all that stuff.
And any downsides that people might be, need to be aware of if they are thinking about getting the procedure?
Well, it's a medical procedure, so every medical procedure has risks with it, and cost. So it can be quite expensive. I would say the minimum amount of cost that it's going to be that gives good results is probably like around $4,500 or something. So for a lot of people, that's a lot of money. So that's a big downside. It has to be worth it to you to spend that kind of money.
Sure.
In terms of medical risks, I've never seen any serious complications, and I've probably done 1,000 procedures myself. Infection is a possibility with any medical procedure. Damage to surrounding structures is a theoretical possibility, but I've never seen that happen before. And those are the same kind of things that surgery can that can happen in surgery, right? But they're kind of more likely in surgery.
So it sounds very, very safe overall, other than having to come back every couple of years, which, it's good for you, I suppose, but, might be, for a tune-up. That's what we're going to call it.
Yeah, it's not ideal for sure. Like guys, very common, like guys want things to be permanent, right? But I will say that nothing in life is permanent. Even if you get breast implants,
Yeah. Oh,
and
yeah.
permanently putting a thing in there, they eventually need to be revised and taken out and redone and stuff. So permanent is not always good. Sometimes people's circumstances change. They don't want it big anymore. They don't care anymore. Not being permanent means things can be revised easily and fixed easily and stuff like that. So no medical procedure is perfect. Nothing has guaranteed perfect outcomes on the first try. And so if we do an injection and 2 weeks later someone says, you know what, there's this little area here that I don't like the way that looks or something like that, we can easily fix it. Permanent things are far more difficult to fix.
Do you ever have to say to somebody, you need to stop? This is too much. It's not looking right. It's going to look. You have people that are just pushing for more, like you say, those sort of women that get those giant, cartoonishly large breasts. Do you have people that you have to kind of say, no, I'm not going to do it again?
Yeah, I have people. It's not like it never comes down to me saying I'm not going to do it, because usually they'll take my advice and I'll say, look, you got enough here. We don't need to do this. And so I think maybe it's like me being a doctor and actual expert in injecting things into penises. Like people will, if I give them advice, they'll usually take it. So no, I've never had to turn anyone down, but I do have patients where it's bordering on absurd. And it's like, you don't trust me. Like, let's not do this. It's not going to be to your benefit.
Here's another thing I just thought of. The waiting room at your office, does it have before and after photos up on the wall? Little samples?
No, that's actually a good idea too. So number one, it's not a 0% chance of someone bringing their like 6-year-old to sit in the lobby with their wife and wait until they're done. So that's not common, but that's happened. And then of course we have like after hours, like cleaning staff and stuff that come through, and they might not want to see a bunch of penises on the wall. So, but it's kind of a funny idea. And actually, it's not a bad idea for the actual consultation room where we could show people.
Or just a photo album, a book that they can leaf through and see photos.
Yeah. Like, so I have an iPhone with where I put all the before after images. And so like, it's not uncommon for me to sit there with people and say, hey, here's some of the ones we just did last week or something like that. They're also, almost all our patients that come to the office have done research on the internet and stuff. And we have like a fairly extensive section of before after pictures on the website.
Oh, you do? Okay.
Yeah.
Okay.
It's on the website. So I would think most guys have looked at it before they come see us. And then I have before after pictures that aren't on the website because I've done a lot of procedures and a lot of them are just in the office.
So what is the website if people want to go to it and check it out?
Yeah. So we have, I have 2 businesses. One is called Upsize. So the website is going to be upsizematters.com.
Okay.
That business has, it's a kind of a medical franchise business, and we have 14 or probably more now. We maybe have 16 offices in the United States and Canada. They're all staffed by doctors that independently own their medical practice and perform our procedure. Depending on what city you're in, you'll see a different doctor. I personally work in my office in San Francisco, and I also have an office in Miami. So I'm in those 2 places. We have another website called Eurosculpt, eurosculpt.com. And that's a company that trains physicians and nurse practitioners and physician assistants in doing the actual procedure.
Okay, that's what I was going to ask you. What's the sort of oversight of these franchises? Because you want a consistent procedure with people that are trained properly. So that's how you do it.
Yeah, well, like we have from the perspective of a doctor or a nurse that wants to do this procedure, we kind of have two options. We have an option where they can be a franchisee under our Upsize business, which right now we have, like I said, I think 16 of them. Or the other option is just to get trained by us, and they can just kind of go off and a lot of medical practitioners have med spas, or they're plastic surgeons. They're just working out of their own office and they want to learn how to do this, and so we'll teach them that and then give them a certification.
What are some of the misconceptions I saw that people might have about this? Because I knew nothing, and so I was just open to hearing things, and I didn't really have any ideas other than sort of the psychological makeup of somebody that would want this. That's the only preconceived idea that I had really coming in. It was more curiosity, but is there other things that people maybe you've seen that they think a certain way and it's maybe not that way?
The thing I hear the most is that I think there's a misconception that guys that do this procedure would have like serious self-esteem issues or confidence issues, or they're weird, or there's something wrong with them. And I'll say that it could be not further from the truth. My patients are everyone from dentists to pediatricians to lawyers, construction guys, like guys that own food trucks.
Yeah.
High school teachers, so it's like everyone that in life is a potential patient, and 99% of them are normal guys that, again, like they're not going to tell you they have it done, right? Like your best friend could have it done. They're not going to tell you that. So I even have one of my friends that I've known my whole life since I was 4 years old. I did the procedure on him. Most important thing people should know, it's not a weird thing. Everyone that comes in our office they're all comfortable. It's not strange. We're all normal there. We're generally speaking having a good time. People leave feeling good. It's just a good experience and easier than people think. It's not as less painful than people think. All those kind of things.
Thank you for clarifying all that. And folks, if you want to find out more, Upsize. Was it upsize.com or
Matters.com?
Upsize Matters. And okay, and the other one is
Urosculpt.com.
And Uro is URO, like urology?
Yeah. UROSCULPT.com. And I would imagine these will go in wherever the links are and whatever platform we're using. So.
Yeah. It'll be in the description. You can find these links, folks out there in podcast land. And I want to thank you for being on the show, and good luck to you and all your businesses. I hope you take some of my ideas and expand it.
I like your ideas, actually. I will. Well, it was nice meeting you, and nice being on the show also.
Much appreciation for you folks listening to The Exploding Human. The website is theexplodinghuman.com. There's a YouTube channel where you can listen. That is The Exploding Human with Bob Nickman. Once again, I'd like to thank Joel Pash for being on the show. You can check out more information at upsizematters.com. Have a great day. Thank you.